Always had to do my hair in ways that didn't feel natural to me because I'm trying to play the game. I had to learn to get the courage to just go, nah, I'm not doing that. Which is why I feel the freedom today. I don't give two craps what people feel about this bald head of mine, because guess what? I love it.
Well, before the now infamous Oscars incident, we'll call it, actress Jada Pinkett Smith released this video about her hair journey. She shaved her head last year after losing her hair due to an autoimmune disorder called alopecia. You guys have heard this term before. So while Chris Rock may have unfairly taken the physical consequence of that joke really was a blow felt by many black women everywhere, because hair loss is no laughing matter. You know, I've talked about my own hair loss on this show. So I wanted to bring in an expert, Dr. Michelle Henry. She's a clinical instructor of dermatology at Weill Cornell Medical College, and she's a founder of Skin and Aesthetic Surgery of Manhattan. So very happy to have you with me this morning, doctor. First and foremost, I'm just curious, why do black women experience hair loss significantly more than any other groups? Now, we aren't impacted by alopecia significantly more, I don't believe, but hair loss in general, it does seem to be something that impacts us disproportionately.
Yes, so there are many types of hair loss that we see more often in the Black community. And part of it is there are some hereditary patterns, and some of them are also due to our own unique styling practices. A lot of the protective styling practices that we do that are very beautiful, but often that tension and that repeat trauma can lead to hair loss. So there are many variables as to why we have hair loss more often in our community.
Well, speaking of hair loss, because, you know, alopecia is our jumping off point, which is, you know, clearly something a lot of people, my friend, Congresswoman Ayanna Pressley, has spoken out beautifully about this. But there are other things that we do to our hair that I'm curious your thoughts, like lace fronts. Are lace fronts good or bad for our hair? Should we be relaxing our hair? What about braids and locks? So what are some things that we can do to preserve our hair?
Yeah, so a lot of what goes on with our hair is that we have this hereditary component. There is a genetic factor. We'll see it in our sisters. We'll see it in our mothers. We'll see it in our fathers. And then there are certain things that we do in our environment to turn on a lot of those genes that contribute to hair loss. So there are a lot of alopecia. Alopecia in general just means hair loss. And then there are many categories of alopecia. So there's traction alopecia, and that's where the lace front is. So that lace front, that lace is really just pulling on the hair. If you take curly hair and you apply a lace front on top of it, it's basically acting like Velcro, and it's tearing the hair. Wow. So lace fronts, tight braids, the glues from lace fronts, tight ponytails, a lot of the things that we do that can be really beautiful, if done improperly, can really damage the hair. And then relaxers. So many people have been using relaxers for years. You know, we're talking a lot about the Crown Act, which is allowing a lot of Black women to wear their hair in their natural state. But historically, many of us have relaxed and done things that would really coax our hair into submission in order to feel professional. And a lot of the studies are showing that relaxers may contain chemicals that could be harmful, that could be endocrine disruptors, that may contribute to things like breast cancer. So it's beyond even the hair loss that we're getting. A lot of the things that we have historically had to do to style our hair, either for our own purpose that we find beautiful or to fit into society, can be damaging and cause alopecia.
And I just want our viewers to know the Crown Act was just passed in the House that makes it illegal for women to be discriminated because of their hairstyle, something that's long overdue. Now, what about weaves and braids, you know, like things that are bonded to our hair? Is that damaging for us?
It can be. It's all about how it's done, how frequently you change it. So a lot of traction alopecia is about repetitive damage. So if you're putting on a hairstyle or you're using weaves or braids and you're keeping it on for months at a time and it's not done correctly, that repetitive trauma can and will lead to hair loss. Any style that you're using that's uncomfortable. You know, I know so many young Black girls are used to that moment where you have your braids and it's tender for a few days and then it gets better. That should not happen. You should not have a hairstyle that is uncomfortable. You should change it more frequently to make sure that you are not getting that constant tension. You should wash it more frequently to get rid of inflammation that can lead to tenderness and hair loss. So, you know, I'm not really dogmatic about not doing this or not doing that. It's about how you do it, doing it safely, having the right stylist, having a dermatologist that can guide you, and doing things in a way that makes you feel good, but also keeps you safe.
Well, I really appreciate you clarifying alopecia, that it's just hair loss, you know, and there are different types of alopecia. I talked about my own hair loss, which I experienced due to uterine fibroids, which, you know, a lot of people weren't aware that that could cause hair loss. As a result, years ago, we call it creamy crack. You know, people call the relaxers creamy crack. I got off that creamy crack probably about 8 years ago. And you see there on the screen when I started experiencing hair loss, and I let my natural curl come back to my hair, and it's been, you know, healthy. So just sending some encouragement to my sisters that the hair can grow back. But I want to hear from you. Once the hair is gone, what are some ways that, you know, like I know if the follicle is damaged, is there something that you can do to stimulate the follicle? What can we do to preserve our hair and be preventative from losing our hair?
Absolutely. And I love that you said preventative. So there's a lot, you know, as a dermatologist who sees a lot of women of color, I have a huge hair practice. Prevention is key. So healthy styling, transitioning from your relaxer was fantastic, keeping those chemicals away, doing those things that are low maintenance, you know, making sure that we're not really traumatizing the hair with our styling practices. So prevention is key. And then the second you notice hair loss, making sure you see a board certified dermatologist. Our treatments are really good at preventing the progression. When it becomes really scarred, it's a little bit more difficult. So we categorize hair loss as scarring and non-scarring. And those scarring hair loss conditions are very, very difficult. However, there's a lot that we can do. So we can make topical preparation. So sometimes we make topical solutions containing everything from minoxidil, which is the generic of Rogaine, to finasteride, which a lot of men know as Propecia. We make really innovative topical solutions. We can inject steroids. So dilute steroids can help to reduce that inflammation. Because when our immune system is active, a lot of that is creating inflammation, and that can distract hair growth and cause scarring of the scalp. Sometimes we'll use topical anti-inflammatories. We've even gotten more innovative today, and we're using things like PRP, which is platelet-rich plasma. So we're drawing the blood, spinning out the platelets. The platelets are a rich reservoir of growth factors. So we activate those growth factors, and we use that to stimulate growth. We're using red light therapy in my office, and even lasers. And at the end, we also have hair transplantation. So a lot of people don't know that we can do hair transplantation even in women of color. So really, there are a lot of therapeutic options for hair loss today.
Well, this has really been helpful, Dr. Henry. I hope you don't have busy Saturday mornings, because I feel like we should have you back many times to answer more questions. Thank you so much for providing this wonderful context, and it's really lovely to have share the screen with you this morning.